health issues, the public we need to the Kumar Maulik is not comfort. Dr. Kumar Maulik.
I am comfort.
Audible, sir. Hello.
Audible.
Okay. Slides correct. Slides. So once again, thank you very much for giving me this opportunity to present on behalf of this National Week. My presentation will cover maximum how the Indian population is severely suffering with malnutrition problems and what are the chances that we need to address using our minimum tools available at ground level. So slides. Just a moment, please. Sir, is it visible?
Yes, sir.
Rajkumar.
Visible, sir.
Rajkumar, sir, is it visible? Hello?
Yes, sir, it is visible and you are also audible.
Okay, right, sir. Thank you very much. Okay. Once again, thank you very much. And my today's talk will cover actually what kind of the food that we are taking in our daily life, what is malnutrition challenges in India, and what are the future perspectives to address these malnutrition problems, what kind of the things, what kind of the initiatives as a student community we have to take to eradicate these malnutrition problems at Indian levels. As we know, that's what my particular presentation will be focusing it on the UG as well as the PG students. So my dear students, as we know that nutrition is one of the most important environmental factors that determines the risk and outcome of many communicable as the non-communicable diseases. Because when compared to the communicable, the non-communicable diseases are taking major portion in Indian population, which has been extending, especially in the ground level. Unhealthy dietary habit is the leading risk of factors of disease burden, contributing to more than half of the deaths due to coronary heart. These are comes under the non-communicable diseases. Among the non-communicable diseases, rather than heart disease, the hypertension and diabetic is one of the challenging aspects that we need to address at community level from student communities. Because many studies, especially ICMR and where presently I am working, National Institute of Nutrition, we are recommending to the community level people the intake of vegetables, green leaf vegetables, fruits, and other things which are very available in and around our community basis. We need to increase to eradicate this malnutrition problem. As recently we published My Plate for the Day of Indian population. My Plate for the Day of Indian population. If you could go through the ICMR NIN website, you will get all kind of the information, including what the My Plate for the Day of food and what kind of the things that we need to take along with our plate in daily lives we have to meet. So, but rather than this, though we are standing rank number 2 in terms of production of fruits, green leaf vegetables, in Indian context, rather than this, more than 80% of the Indian populations are not many studies has been shown. At the other end, cereal consumption is dominating rather than intake of enough level of pulses, legumes, fruits, vegetables, nuts, of course, the milk and egg and other things is also more. So this effect particularly could be pronounced on the infants, fetal life, pregnancy, lactate mothers, and the adolescent girls are being severely suffering. So coming to the next part of view, as we know, by 2050, world is tackled to face estimated more than 9 billion of the population on Earth. But the other end, if you could see, the production of food substances, grains, are very less. So that's what experts are estimating that in coming 1 or 2 decades, the world population is severely suffering with hunger problem on Earth. So in addition of that, the malnutrition practices and the other activities are being studied by the WHO, World Health Organizations, and they framed 13 key positions intake of safer foods at community level. Because as we know, the unsafe food can cause of many diseases, including from diarrhea to major cancer activities also. So in addition of these 13 strategic objectives have been proposed by the WHO, food safety, nutrition, and food security are the important things they need to address to intake the hygienic food in their plate. The cleaning of food substances while preparation of the cooking and selection of uncooked foods. Whatever the selected foods for the cooking, we need to cook thoroughly. All these things is drinking water, playing an important role to eradicate majority of the biological contaminations at community level. So in addition of this, if you could see this statement, foodborne and waterborne diarrheal diseases are killing more than 2.2 million of people annually. Among that, 1.5 million of them are children. This is very shocking news. When you see, among the 2.2 million of the people who are really suffering with waterborne diseases, 1.9 million of children are being dying with this. So in addition of this, the micronutrient malnutrition is great public health and social economic importance at worldwide. So that is the background objectives which we need to address at a community level in addition to eradication of the malnutrition problems. So coming to the nutrients. Nutrients are, especially students, this actually I mentioned that this presentation is especially to students. So the essential nutrients are the essential substances that needs our body in order to grow and stay healthy life. So these may be categorized into actually 6. Among that, micro as well as the macronutrients. It includes carbohydrates, proteins, minerals, vitamins, fats, and water. As we know, more than 90% of the human body is occupied with water. And the food is the first line treatment of any diseases. Without proper diet, disease and many research studies has been already proven. So if you could see here, the International Diabetes Federation, education program, World Health Organization, many research organizations who really giving directions and working on the malnutrition problems eradication at community level, every organization shown that half of the adult population in the world is suffering by the malnutrition and lifestyle diseases. Half of the world population, my dear students, especially the non-communicable diseases as well as the malnutrition, such as diabetes, hypertension, heart diseases, kidney diseases, and may be strictly cured by along with healthy diet if we can opt in our daily life. Among these problems, the Indian population has been severely suffering with micronutrient malnutrition, though as I mentioned that we are standing at rank number 2 in terms of production of green leafy vegetables and other things. This we need to address at community. This is the recently published paper. If you could see the shocking news here, micronutrient deficiencies and the conditions of prevalence. As we know, here the micronutrients, iodine, iron, zinc, vitamin A, and many particularly D, which leads to rickets. So the iodine deficiency, 3 million population are at risk. Deficiency is, hypothyroidism, iodine, the metabolic disorders, in addition of hormones interaction and some. This is also one of the severe problems in the developed countries. So even the 5th National Health Family Survey is recent, and 5th survey here is. In 4th survey, they mentioned that 53% of the women at reproductive age group are suffering with anemia. But coming to the 5th survey recently, 2020 population, you could see the anemia has been increased from 50 reproductive age, and this deficiency leads in adolescent girls and the children of below age of the 9 years. And the zinc deficiency is also properly not estimating, but when compared to the developed nations, the zinc deficiency is very high, and many people are risk, particularly in the developing countries. Poor pregnancy outcomes, impaired growth, many things, it has been already noticed by the zinc deficiency. And the vitamin A deficiency, though in last 2 decades, it has been come down, but since it is a severe problem at Indian children, that we need to address the night blindness, xerophthalmia, and the other mortality rates related to the other micronutrients. And the other micronutrients, vitamin B12 and the thiamine, like a B complex proteins deficiency is also very predominantly found, especially in the marginal underdeveloped countries. Of course, so far the data is not properly available, insufficient data, which the authors are published in this publication. And in addition of that, the fluorosis is one of the conditions which many country people are severely suffering due to not properly intake of pure water, and then the calcium, selenium, all these things. So coming to the malnutrition problems and children conditions in India, as we know, the father of Green Revolution in India, M.S. Swaminathan, he already discussed, when we discussed about with him, actually, he was worrying about this issue that after 70 years of independence, still the malnutrition continues to plague in Indian context. Then we have to think that what kind of the things and what kind of the activities that we need to initiate to address these malnutrition problems, especially at community, particularly the resource and poor people and undernourished people who are living in the society. The micronutrient malnutrition is a challenging issue at community level. We have to address on the priority basis from community level to the policy makers. And this article actually mentioned that in 2018, WHO report mentioned that because of the malnutrition problems, more than 40,000 of children at India level are suffering and they sacrificing their lives at community level. So this malnutrition, if you could classify this malnutrition, undernutrition and overnutrition, because earlier majority of the population are being suffering with undernutrition. Now the situation has been slowly transferring from the overnourished population, as the problem it was only in developed nations earlier. These kind of developed the overnutrition problem is basically obesity. These problems are also we are inviting attracting towards the street foods, junk foods, like whatever we are looking into the streets. Biggest problem, and it is also challenging problem along with the undernutrition, how to eradicate at community level. Global hunger index, if you could see the what India is, if you could see this graph, global hunger index score trends, out of 119 countries at global level, India 119 countries in terms of global hunger index. Global hunger index. So it is a serious level of hunger. Second largest and other things. Coming to the projections of malnutrition activities in India. So the first 3 lines is mentioning about the global malnutrition problems. Globally, the stunted children is more than 150 million, which are the under 5 years of the age, and the wasted children are more than and overweight 38 million. India accounts 1/3 of the world's stunted children, you see, with almost 40. If you could see here, the stunted more than 150 million of under 5 years of the age. Among that, more than 1/3 of the children, the stunted children are especially in Indian context, followed by Nigeria, of course, Pakistan, and the wasted children are more than 20. Anemia, as I mentioned, now already 7% of the reproductive is severely suffering with anemia at Indian context. So for now, who are working under the guidelines of FAO, Food and Agriculture Organization, as well as the World Health Organization, they need to take serious initiative to address these problems. But the India progress in terms of to eradication of this malnutrition problem is extremely slow in terms of underweight as well as anemia and malnutrition problems. So the other thing. So far we are discussing about America, because when we are talking about the developed countries, the first example which we are mentioning about is America. In 1960s, especially the nutrition science is being dominated by 2 conflicting observations. One is how to eat healthy and maintain a healthy diet, and the second one is in those time onwards, because in 1960s onwards, how to reduce the non-communicable diseases as well as the obesity and the diabetes, which the America thought of in 1960s, and there has been taken initiatives to reduce these malnutrition problems from 1960s onwards. So in 1960s, coming to the research publications wise, only 13% of the Americans were obese and only 1% were diabetes. But in 1980s, if you could see from 1960 to 2018, 2018, this is, as I mentioned, Global Nutrition Report of 2018 data, which I'm presenting here. So in 2018, the obese population in Americans are almost triple. Because in 1960, only 13% of the Americans were obese. That means it close to 40% of Americans were obese in 2018 as well as, and the diabetic rate of increase is also more than sevenfold in US. So the same kind of trend has been continuing in developing world, especially in the Asian continent, especially in India, Bangladesh, Nepal, and the other countries in Asian continent. As well, in the research literature, if you could see on obesity, also has been balanced. It has been ballooned. In 1960s, only 1,100 articles are being published on obesity and diabetes. But in 2015, more than 44,000 of articles which are particularly related to the obesity and diabetic are published. So the undernutrition conditions in India is also remains shockingly high despite the impressive reduction in stunting. Of course, it has only in last 1 decade, only the stunted children has little bit come down. So this particular risk is continues to goes to adolescent girls, as I mentioned, women and children, socially and economically deprived communities, especially SC/ST communities. The reasons behind this one is, as the United Nations Population Fund Agency, it is one of the agency, recognized agency being the government of America, which they mentioned that the reason behind this undernutrition as well as the malnutrition at Indian context is more than 50% of the village women and girls in India are married before they turn 18 by violation of the law. So this condition is leading more than 30% of children are born with low birth weight and 7 million are potentially wasted and stunted in Indian context. This is the shocking news which we need to educate everyone at a community level how to address this problem, especially after 2025 global targets for maternal, infant, and young children nutrition, which they wanted to completely eradicate this situation, including the developing nations by 2025. But coming to the Indian stagnancy and the progress in terms of malnutrition, even we cannot expecting the complete eradication of these kind of the targets which are given by the WHO even by 2030 in India, because the progress of malnutrition eradication activities from policymakers to the ground level is very slow. And the children and nutrition and anemia status of children in India, if you could see, as I mentioned, underweight, of course, it has come down. Stunted population also has come down. Wasted population is slowly increasing. And anemic conditions also, of course, slowly it has been coming down. But we need to take much initiative to address these malnutrition problems. If you could see the Indian strategic graph in terms of the anemia among the women, this white shows, of course, there is no data is available, and the prevalence, very high prevalence, more than 60%. If you could see, many states in Indian context are severely suffering with high prevalence of anemia. Even close to 50% prevalence of anemia is also, if you could see, yellow. That's what the fifth National Family Health Survey has pronounced properly that India is one of the countries that we need to take initiatives to address, especially this anemia problem and stunted wasted problems in ground level population. So if you could compare, Africa, Asia bear the greatest share of all forms of the malnutrition among the 7 continents. So we have already 7 continents at global level, but among that, more than half of the malnutrition children and the anemic women are so far staying in Africa and Asian continent only. So among that, again, now the Africa, because they increased the intake of pulses, the Asia is
Sir,
Hello.
um, sorry, it seems to be a poor connection with Dr. Srinivasana Rao. So, we'll contact. Hello. Hello. Meet जे আছে তাকে রেডি করে দাও। There is some network issues, and we are trying to connect with the Dr. Srinivasana Rao sir. Please wait.
Morning, madam. Hello. Hello. हेलो मैडम सुनते बात है सुनाई दे रहा है मैडम
Monica, am I audible? Hello.
Yes, audible, sir. Audible.
Sir, you are audible.
You are audible.
Hello. Sorry for the inconvenience. May I audible now? May I audible?
Yes, sir. You are.
Hello. Right. Okay. Just a moment, please.
मेरा एक क्वेरी है मैडम हेलो
Yes, sir.
हाँ मैडम मैं बोल रहा हूँ कि
The microphone is turned off. Sitaram Shukul. Have you any question?
हेलो सुन पा रहे
Yeah. Anybody?
मैं बोल रहा हूँ कि जो लोग ऐड है ना पहले से उसको रिमूव किया जा रहा है और कुछ आदमी ऐड नहीं हो पा रहा है तो उसका जब रिक्वेस्ट आ रहा है तो डिनाई कर रहा है ये यूट्यूब
Yes, sir. Continue your speech. Sir. Rao sir, continue your speech. It's an interruption from anyone, so avoid this.
No, I'm trying to sharing the slides, ma'am. Screen. I'm
Yes,
trying
sir.
to
Yes,
sharing
sir.
the screen.
Please continue. Yes, sir. Please continue.
What's the problem? What happened?
Sir, please continue.
స్క్రీన్ షేర్ చేయడానికి రావట్లేదు ఇది రావాలి
Yeah, by the time any doubts from student community or faculty?
Yes, sir. There are few questions.
Yeah, ma'am.
Like we have a few questions from Amol Kumar Moli. Sir asking for hyperthyroid also one factor in society when need to avoid iodine intake. How through nutrition we can support those patients?
Oh, interesting question, Momika. But okay, actually, the hyperthyroidism or hypothyroidism? What do you mean?
It's hyperthyroid.
Hyper-
Hyperthyroid, sir.
Actually, NIN developed one double fortification of this thyroid gland, madam. Of course, but at national level, it has not been distributed at national level. But soon the government of India Health Ministry is launching officially at national level. Of course, at this moment, that is the only solution for the thyroid problems. Of course, that is also one of the parts coming under the nutritional activities. That's what one of my slides already mentioned that more than 2 billion population at globally are suffering with iodine deficiency also. That's what especially ICMR NIN particularly worked it on the salt preparation. That means double fortified salt. Double fortified salt, and soon it has been launched by the government of India Health Ministry.
And there is another question from Amol Kumar Malik sir, and
Yeah.
the question is, what do you suggest for FBOs who are manufacturing packed foods on nutritional advanced research point of view?
What is that ACO, sir? What does it mean?
What do you suggest for FBOs who are manufacturing packed foods on nutritional advanced research point of view?
Yeah, madam. Actually, my presentation will cover that activities also in terms of processing foods and the losses of nutrients.
Okay, please continue your speech.
Is it, madam? Is it visible?
Yes, sir, visible. It's
Hello?
visible and audible. Yes, sir.
Is it visible, ma'am?
Yes, sir, it's visible.
Okay, right. Okay. Sorry for the inconvenience, because here some power fluctuation problem is there. Once again, just I'm extremely sorry from my end. So these are the human resources, especially in an Indian context. As I mentioned, the shortfalls, especially in health point of view, is particularly in India, health is coming under the state subject. So the central doesn't have any rights to give directions to all the states, which saying these are the facts that you have to maintain like this, like this. That's what this is the major drawback at Indian context, which health is coming under the state subject, and the people also doesn't have proper knowledge and skills about this malnutritional activities. In Indian population especially, they are having very short-term visions, and the regulations are many in India, but the maintenance and implementation of regulations being makers are very poor, and the community mobilization is almost nil in Indian context in terms of health. It's coming to the action plans that we need to be initiated is more health insurance coverages that we need to recommend, and the registration of private facilities, and ensure minimum standards that we need to maintain with minimum financial activities, improve efficiency within the system, strengthen leadership among the medical fraternities, shift from doctor-centric care to the community-centric care is one of the activities. And public health leadership and community voice is also important in Indian context. So these are the shortfalls, especially, and what are the actions that we need to be taken at the community level from policymakers is also mentioned. So coming to the non-communicable diseases, just I don't want to take much time here to talk about these non-communicable diseases. As I mentioned in my introduction itself, diabetic mellitus is one of the predominant problem in Indian context. It is a group of diseases characterized by high levels of blood glucose resulting from defects in insulin production, insulin action, or production and action both. As we know, the types of diabetic is of three: type 1, type 2, and the important type which I would like to mention here is gestational diabetic mellitus, which is the predominant problem in India rather than the world population. As we know, the gestational diabetic mellitus is having during pregnancy, and it leads to the overweight of the baby. It gives a lot of troubles at the time of birth, and it is common among obese women and and the woman family history of diabetes, those who are really suffering. This gestational diabetic mellitus puts rescue maximum leads to the type 2 diabetic mellitus. The one thing I would like to mention here is world data about the gestational diabetic mellitus is saying that every 14 out of 100 pregnant females are developing gestational diabetes. But coming to the Indian context, every 18 out of 100 pregnant females are severely suffering with diabetic mellitus. Here also just we are dominating in terms of the development of gestational diabetic mellitus. This is also one of the serious issues, especially the nutrition postgraduate students and those who are really working for their PhD thesis. The students needs to look after these gestational diabetic problems, which interlinked with the nutritional activities. So this is the recently published paper in 2014. It is differing the diabetic mellitus problem between rural population and urban population. So earlier, one issue was there that either the non-communicable diseases increasing ratio is much in the urban population. Coming to the rural population, you see now, where I am talking from, the Andhra Pradesh, even the West Godavari and East Godavari, these are the much agriculture practice districts in Andhra Pradesh, but the diabetic mellitus condition is day to day has been increasing even in the rural population also. What I mean to say, of course, in the urban population, now the organic foods are playing little bit important role in terms of improving the micronutrient status in the food quantity, like iron and folic acid, all these things, of course, organic foods, but how they are sustaining and how it is reaching to the population is important. So this slide is particularly showing that what I would like to say you is India is one of the countries by 2030 we are trying to standing at rank number 1 in terms of the diabetic mellitus population. The world population graph is also here, but among this, India is one of the countries which we are leading and improving the diabetic cases by 2030. The second problem here in the non-communicable diseases is cardiovascular diseases. So this is also more than 17 million people or die in 2018. More than 3 million of these deaths occurs before the age of 60. That is also one of the leading cases of diabetic cardiovascular diseases in Asian continent especially. So I don't want to talk about all these things. If you could see these two red lines, the coronary vascular diseases death rate is 272 per 100,000 population in India. It is very higher than the global average, only 235 per 100,000 population. So in India, the death rate of cardiovascular diseases is 272 per every 1,000 population. Sorry, every 100,000 population. So this percentage is very high when compared to the global data, which the global data is showing only 235 deaths per 100,000 population. And the premature mortality rates as per the Delhi is also very high in India when compared to the global data. So this is the Indian author which he published the paper among the prevalence of hypertension in India, and he compared the urban population as well as the rural population. The sample size as well as the prevalences are so most. Gupta et al. In 2004, you see now almost it is close to 2 decades back. They mentioned that this is a Mumbai study and the sample size is also close to 1 lakh, my dear, you see here. But they found that in 2004 itself, the prevalence of cardiovascular diseases is close to 50%. It close to 50%. It is a shocking news to every Indians that we need to address this problem after improving the nutritional activities in our daily life. And coming to the rural population, as the Bharadwaj in 2010 published Himachal Pradesh study, they mentioned that, of course, here the sample size is questionable, though it is just close to 1100, but the prevalence in rural population is close to 36% of the prevalence of cardiovascular diseases in rural population. So this is the trend and the cardiovascular disease burden in Indian context. In 1990, the cardiovascular diseases and coronary artery disorders percentages in India, coming to the 2020, the percentage is almost double. The percentage is almost double. Please. Hello. And even the China and the other countries, the progressive rate of these coronary and cardiovascular diseases is very slow. Especially the reason behind these cardiovascular diseases and the micronutrient malnutrition diseases, many studies has mentioned that the knowledge gap among the people of these non-communicable diseases and regions, as well as the policy regulations published in 2016 by Prabhakaran et al. These are the gaps that they found in terms of developing the coronary vascular diseases, cardiovascular diseases, diabetic, and other non-communicable along with the communicable diseases. These are the gaps of and knowledges in society as well as the public, and these are the research needs that immediately, especially the UG and PG students, which they need to turn towards the community level to address these problems. And the policymakers, they need to have to connect a bridge between the students as well as the policymakers to address these gaps and to connect the bridge from policymakers in between students to the community level, especially in the ground level. And the tuberculosis is also one of the problems. This may be one of the reasons by the chewing as well as the smoking population. And among the global data, 1/3 of the world population has been infected with tuberculosis bacteria. But 1/3 of the population are living again in the India. Among the global data you see, again we are more than 20% of the population of the tuberculosis are living in the India, next to other countries. And China, though population wise it is the leading country in the world, but only 14% of the population are living with a tuberculosis problem in China. But in India, more than 20% of the population are severely suffering with tuberculosis. And the next one is the cancer. By 2035, these are the projections again published by the WHO. By 2035, India is one of the predominating country in terms of the cancer patients. And we can occupy majority of the cancer people living in Indian context. Reasons are many for the non-communicable disease across the globe. So among that, the few reasons here are high consumption of refined grain, consumption of high fat and salty food, low consumption of dietary fiber. As we know, dietary fiber is playing an important role in terms of the bioaccessibility and bioavailability bioavailability of the essential nutrients after digestion takes place from gut to reach into the liver. And a low consumption of green leafy vegetables, low consumption of fruits and vegetables, consumption of high sugar containing foods, of course many things. And the important things which is lacking at global level is physically inactive problems, lack of exercises, and we are turning towards the sedentary lifestyles. Of course, in addition of that, the other reasons are high alcohol consumption, tobacco chewing. If you could see the things here, once upon a time, after 2.5 million years, the situation of human life was like this. And this within these 50 years, even if you could see in Indian context, after the independence, after 70 years of the independence, the situation of human population, they are unable to even stand and switch on the TVs. This is the situation, especially in Indian population. Of course, in addition of those things, the other things are urbanization, lifestyle changes, smoking, as I mentioned, and these are the things which we are turning towards. What are the nutritional challenges at ground level and food security issues in India? As we know, as a food and nutrition students, the food is separate as well as the nutritional activities when they are working it after digestion of the food is also differ here. It is the material consisting of essentially proteins, that means the macromolecules of proteins, carbohydrates, fat, and which are used in the body to maintain and to sustain the growth, repair, and vital processes, and to furnish energy, which leads to supplementing the activity energy through the electron transport chains, as the students knows. And nutrition is art and also a science. Nutrition is defined as the science of foods, the nutrients and other substances. They are in action, interaction, and balancing in relaxation in relation to health and diseases. Again, I don't want to discuss the percentage of people, undernourished people at global level, and all these things. So if you could see this chart, relationship between nutrition and infection. See here. The one thing is, majority of the people are severely suffering with malnutrition problems as well. Our nutrition problem is overeating and infective diseases. So the immune deficiency disease, severe immune deficiency is also related to the nutrition and food, malnutrition and infectious diseases, effect of nutrition on immune systems. These are all the sub activities which are interlinked with food and nutrition. So when we initiate about the classification of the daily intake foods, these can be classified into two types based on functions and based on nutrients. The functional foods here are again carbohydrates, fats coming under the energy yielding foods, because these two are by oxidation mechanism. When the carbohydrate, as in the form of glucose, is entering into the oxidation mechanism, it can be converted into the pyruvic acid, and it is again translocating from cytoplasm to the matrix of mitochondria, which is involving in the TCA cycle and yielding a lot of high energy molecules in terms of ATPs and NADPH2s, which can be translocated through the electron chain, where the energy exists in the body. Immediately the fats can be involving into the beta oxidation process. Thereafter the proteins are involving into the transamination and deamination process. In addition of that, based on functional foods, proteins are body building foods, which they are managing. The systematic foods are again minerals and vitamins. The nutrients are macronutrients, again micronutrients, carbohydrates, fats, proteins, minerals, and all these foods it will come. So what sort of things that the Indian population need to do to address these gaps at a community level? These are all the NIN studies. As I mentioned several times in my previous slides, though India ranks in the second in terms of production of green leafy vegetables next to China, but the consumption is very low due to the ignorance of health benefits of these green leafy vegetables as well as the vegetables being available in and around in our house itself. So this is the previous data, National Nutrition Monitoring Bureau 2012 data. As per the 2012 data, the median intake of vitamin A is 124 microgram of consumption unit per day. But now in 2020, recently RDA published data by the ICMR NIN. In addition of this 124, in 2012, the recommended dietary allowance proposed 600 microgram of consumption unit per day of vitamin A. But in addition of this 600 microgram, we are taking only 124 microgram per consumption unit per day. But this 600 microgram of consumption unit per day of vitamin A, in 2020 RDA recommended 1000 microgram. So in 2012, we are unable to meet even the recommended dietary allowance of 600 micrograms. Now you see the lifestyle changes, how it has been changed. In 2020, we are recommending now 1000 microgram per consumption unit per day. And the consumption of other vegetables and fruits as per the Indian context is, in 2012, 29 gram consumption unit per day. Out of 100 grams, we're supposed to meet per day. Leafy vegetables are 40 grams out of 100 grams. Other vegetables are 48 grams out of 60 grams. Roots and tubers only we are meeting according to the recommended dietary allowances. What studies are telling? Many studies are telling, and why we need to give much priority in terms of increasing levels, increasing intake of green leafy vegetables. Many epidemiological studies related to green leafy vegetables helps decrease the risk of cancers, coronary vascular diseases, cataract, macular degenerations, and the other age-related diseases. You see, in 2007 study, it has mentioned if you could increase the intake of green leafy vegetables, these problems may come down. And in addition of that, the Indian culinary practices, commonly green leafy vegetables are cooked at home as per convenient and taste, also one of the problems in India. In 2011, from CFTRI Mysore and myself, Vimala et al. Group, already we published one data on only vitamin A conversion from beta carotene. As we know that in our human body, especially in the living organisms, we cannot get vitamin A as in the form of vitamin A. After intake of green leafy vegetables, whatever the carotenoids, especially the beta carotene, it can be converted into the vitamin A with the help of many factors. Of course, we found that while cooking itself, because vitamin A, vitamin C, B5, these are the oxidizing agents. Even at room temperature also, we cannot get the beta carotene, vitamin C, and vitamin B. So we had studied the beta carotene levels, vitamin C levels using the commonly consumed methods in Indian context, and we found that while cooking itself, from where we are. So, and the other studies are also mentioning that parts of the balanced diets. So, these green leafy vegetables, fruits are good sources, as we mentioned. In addition of these micronutrients and macronutrients, some phytochemicals, like especially phenolics, carotenoids, and the other phytochemicals are also improving the immune system. Completely the different slide from what we are discussing, and millets as well as the oil seeds. If you could see, of course, I think this slide is not a need to you. The food grains, cereals, coarse cereals, pulses, oil seeds, rice, wheat. From 1986 to 2007, 1986 to 2007, if you could see the yielding production percentage and yields, the production percentage of all these essential things which they are very much needed to improve the health issues of humans are being coming down. Rather than that, the cereal production only is increasing. You see, procurement of rice and wheat in million tons. The same year from 2002 to 2003 to 2010, the procurement of wheat and the procurement of rice quantity
Once again, we lost our connection with Dr. Srinivasana Rao sir. We can't connect with him. So, there is some network issues. We are trying to reconnect with sir, but we lost connection with him. Sorry for the inconvenience. Very sorry. We are trying to connect with him. No, sir. Just a few seconds. We are trying to reconnect with her, with him. So again left.
Madam, am I audible?
Yes, yes, sir,
Hello?
audible. Yes, sir, audible. Yes, sir, audible.
Yeah. Yes. Yeah.
So please continue.
Amika, is it visible?
Yes, sir.
Hello?
Visible. Yes, sir, visible.
Yeah. Once again, I'm very sorry. So coming to the nutrient intakes, percentage of recommended dietary intakes from 1975 to 2012. Starting from protein to niacin, vitamin C, the nutrient intake from 1975 to 2012 has been declined. Of course, many reasons are there behind this one. I shall try to wind up as early as possible. And the average household consumption of foodstuffs as percentage recommended index is also coming down from cereals to, of course, sugars and jaggery. This is nutrient index. So, my dear students, if you could see here, if an adult man 60 kg weight, reference weight, he is supposed to meet as per the recommended dietary allowance is 2,730 kilocalories per day. But the Indian studies are shown that the actual intake of this adult man, 60 kg of adult man, is meeting only 2,000 kilocalories per day. This is the nutrition energy gap in Indian context of a 60 kg adult man. 730 kilocalories of nutrient energy has been met by an average adult man who is the weight of 60 kg. Coming to the adult woman, if she is 55 kilocalories weight, she is supposed to meet 2,230 kilocalories per day, rather than she is meeting only 1,738 kilocalories, which leads to 492 kilocalories of gap. Not only the adult man, adult woman, the pregnant woman, lactating mother, everybody age groups from 1 to 16, 17 years of children are also severely suffering to meet the recommended dietary allowance energy recommended by the NIN ICFR. Of course, this is the same study, NNMB study, which it was compared with the RDA values. As I mentioned, what are the processing methods, which I mentioned, we published already a couple of papers on this processing method. Many evidences are there that homogenization and thermal treatment, especially the processing methods, have positive effects on the bioaccessibility of micronutrients. Whereas the presence of dietary fiber has a negative effect. Dietary fiber has a negative effect. The other studies are also reported that fat is one of the important component which requires the micellization. By that way, it enhances the absorption of carotenoids. In our study itself, already we found that. Of course, the visceral fat is also one of the problems which leads to the coronary and cardiovascular diseases. But to some extent, if we could maintain the fat level, it helps to enhancing the absorption of carotenoids and the other oxidative components like vitamin C and the vitamin B5. These things, the many studies are also showing. So beta carotene uptake in human subjects, many studies are also mentioned that raw carotenes and the carotenes, they have been compared. So when compared to the raw carotenes, the cooked carotenes absorption is high when compared to the raw carotenes. If you could see here, the cooked carotenes percentage of absorption is 65 when compared to the raw carotenes of only 41%. Of course, many studies. These homogenization process and thermal treatment processes of food substances also helping to absorb and bioefficacy activities in terms of the human life. But the other ends, this if we will not take proper care in terms of processing methods, the essential nutrients, that means the micronutrient content of food, which may decline and may not be reached liver and not maintaining proper nutritional activities in human health. These are the studies are telling. Of course, this I don't want to take much time. Again, the saturated fats, unsaturated fats, bad cholesterol and good cholesterol. I think students know better than me. I hope that this slide also. And this is the slide which is telling the comparison of cooking fats between monounsaturated, polyunsaturated and saturated fats. As we know, the monounsaturated fats are somehow good to protect the cholesterol levels, to increase the good cholesterol level and reduce the levels of bad cholesterol, reduces the risk of heart diseases and diabetes. And the polyunsaturated fat is quite opposite when compared to the functions of monounsaturated fats. And the saturated fats are also increasing levels of vegan cholesterol as well as the polyunsaturated fat and increase the risk of cardiovascular diseases. Whatever so-called the oils which we are using in the community, if you could see, olive oil, peanut oil, corn oil, soya oil, sunflower oil, butter oil, that means coconut oil. These are the percentages of monounsaturated fatty acids, and the blue line is, slight blue line is showing the polyunsaturated fatty acids, and the red line is showing the saturated fatty acid components. So far the oils which we are using. And this is also again monounsaturated, polyunsaturated and saturated fatty acids percentages. Okay. So far we discussed about the nutritional activities at Indian context, how to eradicate, and what is the role of green leaf vegetables, fruits, if we could opt as per the recommended dietary allowances. So these just I want to discuss a few slides, particularly about the research areas that students need to enter into their career. My dear students, so now the India is severely suffering with micronutrient malnutrition problems, as everyone we know. Among the micronutrient malnutrition, iron, zinc, vitamin A, folic acid, vitamin B12. These 4 or 5 micronutrients are playing an important role from the mouth to gut and every digestion problems. So in addition of the research activities in these micromolecules can be categorized into 4: basic research, clinical research, program research, policy research. Of course, policy research will not come into consideration. The government's supposed to take it. They are taking initiative. We have the policy research with program research, but the basic research as well as the clinical research we need to address. So before going to discuss about the basic research, if you could see the trends of nutrition. Yeah, Momika, tell me.
Yeah, sir. Sorry
Hello?
for the interruption. Yes.
Yeah.
Sorry for the interruption, but sir, please, respected sir, please, please conclude your speech in briefly, because we are time is running late to the next session.
Yeah, sure, madam. Just 5 minutes. Is it okay? 5 minutes.
Yes, sir. 5 to 10 minutes.
Yeah.
you can.
Fine, Momika. Okay, thank you. Okay, if you could consider the trends in nutrition research outcomes and impact factors among China, India, and US. So from 2000 to 2010, you see that China, the publications of nutrition research has been increased. Of course, US, we cannot say anything. Since from 2000 onwards, they are giving much priority to improve the nutrition research, and they are giving the lightening to the population, awakening the population how to control the malnutrition problems while increasing the intake of vegetables. Of course, India still we are far behind. Of course, as an Indian, we should not supposed to talk. These are the especially the research articles which are playing important role in terms of the impact factor, but we are far behind in terms of the publications also. As I mentioned, the basic research, the nutrition students and community studies students, we need to take up the responsibility at community level to address these problems. Because the biomarkers of micronutrient status from food substances improvement is very easy. So before going to enter into the research, if you could have to have a proper knowledge in the published papers, so you will study, definitely it must be useful to the improvement of nutrition gaps and to address the malnutrition problems in Indian context. Because the reason behind is why I'm telling is the currently available biomarkers represent steps too far along the disease process in India. We need to come up with some new progress and new biomarkers which needs to interact with the clinical research. Then only it is very easy to address the malnutrition problems in Indian context. It may be possible along with the proteomics, nutritional genomics to identify subclinical indicator levels in human health to address these malnutrition problems along with the other micronutrient gaps also. So the other problem in Indian context is every 10 years, just we are updating our RDA. Of course, this time 20 years, after 20 years, in 2000 we released the RDA, and 2020 just now recently we released the RDA. It make the time needs to come down every 5 years or something. We need to release the RDA according to the societal levels and the population food habits, how they are meeting. The bioavailability studies in terms of the micronutrients also need to address and need to overcome the problem. Actually, what could be the sort of problems, how they are preventing the essential substances accessibility and bioavailability. For example, phytic acid. Many anti-nutrients which are preventing, even after digestion, with these components are preventing the accessible of essential nutrients and the absorbance from small intestine to liver. These kind of the studies that we need to take initiative. And the other problem here is we have only raw foods nutrition data. Rather than that, if you could see the developed nations, they have already processed foods nutritional data is also there. We need to develop the processed foods nutritional data. As I mentioned, the clean, due to time factor, I'm not taking much time again. Of course, once again, I'm very sorry from my end due to some disturbances. The programmed research, as I mentioned, the translational research and the food fortification programs in the Indian context, large-scale epidemiological studies data is also very much needed to address these problems. And the country investments, the food policies, as well as the FSSAI guidelines and the regulations, we need to address it few things. And the funding agencies are also, they must have to come up with some proposals which they have to address these problems when the proposal is coming with a multi-centric central study. Otherwise, rather than thinking in a single brain, if you would have to have 3 or 4 brains at a time, if you could think it about the problem, I think the solution may be very easy. The policy researches, as I mentioned, the projections coming to the India is from 1 or 2 decades onwards, Indian scientists has contributing substantially to the global efforts to review the ongoing transitions and evolve appropriate definition of food security recommendations regarding human nutrient requirements and develop appropriate standards for assessment of nutritional status. Still, we have far behind to meet the nutrition gaps knowledge when compared to the developed knowledge, developed food processing activities. Of course, these are the challenges. The first one is non-communicable diseases. As this non-communicable diseases is, again, the dual burden, which is interlinked with the substances only. And the most important thing which I would like to mention, particularly to the students, is the Indian nutrition research output is disproportionately low considering its large population and its huge dual nutritional challenges and public health concern, because India is such a population country, which we have different biodiversified zones, and the food habits are also zone to zone differ. That's what the first we need to focusing it to develop the database, particularly using the processed foods. Then only the secondary things we can expect many things. And coming to the research perspectives, in-depth research, as I mentioned, using the characterized better markers is also important. Large-scale trials, especially the epidemiological trials, and the data using the epidemiology is also important. And the recent research studies, especially in terms of this micronutrient malnutrition, projecting that microgreens, these are the recently hearing words, already the developed nations are being utilizing these microgreens as the substances along with food, and the organic foods also we need to improve. In addition of that, many things, as I mentioned, these are the 5 keys for household safety. If you could visit the NIN website, you may have all the information how to eat and what is the safety food, how we will prepare at household level using the available things in and around. These are the core research areas. Global food security is also one of the recent area which we need to address using the microgreens as well as the genetic foods. Microbiome, microflora area, as well as gene expression area. These are the interlinks. Again, energy, metabolism, inflammation, aging, bioengineering activities, nutrition education, interdisciplinary. That means it particularly involves the cross-sectional studies among the micronutrients as well as the epidemiology studies. Researchers that they need to interact with the experts like scientists, professors, and the policy makers, especially students. They need to address these gaps. And the important issue that we need to address is street foods and junk foods. This is the major challenge of the Indian context that we need to address. Of course, these are the national priorities that every student needs to think. Periodic assessment of nutrient intakes, health and nutrition status to development of the optimal health, establishment of dietary research intakes values and RDI developments every 5 years, identify various nutrition deficiency disorders, prevalent population. Of course, many are there. This is my research team. And once again, thank you very much. Before that, I'm extremely sorry the shortfalls due to the internet connection problem here in my village. Yeah, thank you. And it's over from my end.
Thank you, sir, for your valuable
Momika, yeah.
insights on malnutrition problems in India and future challenges to our esteemed audience. Thank you once again, sir. There is
Yeah.
seems like no questions after that. So
Yeah.
we move into the next session, and due to some issues, there is a little bit change in our technical session. So with that, we will go ahead towards the first technical session of the day. And now, may I now request to Dr. Prithviraj Karuk sir from Department of Physiology, Bankura Christian College, to introduce our first speaker of the day, Professor Devidas Ghosh sir.
Thank you, Momita. Is it audible, Momita?
Sir. Yes, sir, audible. Yes, sir.
Previous lecture presented by Dr. Rao nicely pointed out about the malnutrition status of India, and also sir talked about the detail about micro and macronutrients. Without not further delay, let me introduce Professor Devidas Ghosh sir. Professor Devidas Ghosh sir is one of the renowned professor in this field. Presently, sir is working as a professor in biomedical laboratory science and management and clinical nutrition, Vidyasagar University. Professor Ghosh sir obtained MSc, MPhil, PhD from Calcutta University. He has 36 years of teaching and research experience in the field of reproductive endocrinology, nutrigenomics, public health, and drug development. Also obtained UGC Research Award, Indo-Tunisia of West Bengal, Tata Research Foundation, Government of India, pharmaceutical companies, and one international project of Government of India and Government of Tunisia. He has 2 Indian patents on antidiabetic phytomolecules, and another is in pipeline. As a request, Professor Ghosh to deliver his valuable lecture, I am sure all the audience, including us also, will get the loaded of information after this lecture. Please, sir, deliver your.
Professor Ghosh, good morning. Yeah, how are you?
Please, sir.
Hello.
Sir, are you audible?
Yes.
Yeah.
Hello, Srinivasji. Hello, Srinivasji.
Yes, sir. Sir, good morning. How are you?
Good morning.
All right, sir. Carry on. We will talk later. Yeah,
Okay,
I'm fine,
so
sir. Carry on, sir.
I am very much grateful that you have also accepted our invitation, and you also deliver your lecture, and our students have been benefited from your informative lecture.
Yeah,
Okay.
sorry, sir, because
Hello.
it was little disturbance because I was
No,
having.
I realize it. Okay, and here is also the connection is broadband line is also not operating properly. But before going to my lecture, Srinivasji, I have only one query. Though the time is limitation, but I do not lose this opportunity because we are not able to keep in contact frequently. In 2020, the ICMR also gave a revised that is RDA for the macro and micronutrients. Okay, and most of the data also furnished by NIM, where you are also working. In case of the micronutrient, mainly especially in case of iron, in lactating stage, the iron requirement is far less than the normal female. What is the justification? I do not know actually. It is my query that.
Yeah, sure, sir. We will discuss later, sir, because I was having some doubts.
That is lactating mother. In lactating mother, iron requirement is far less than the normal woman having the same age. have you enlightened this difference between the iron requirement of the lactating mother as per 2020 ICMR RDA and the normal female? Am I clear?
Professor,
Am I clear?
yes, Professor Ghosh, yeah, do definitely. Of course, what you raised, the question is right. We will discuss later. Now you continue your talk, sir.
Okay. Thank you.
Right, sir.
It is also must to a student also, and if you give answer, then I also convey this answer to our student also. Okay.
Sure,
Thank you.
sir. Right. Okay, carry on.
So, good day and welcome all of you to this one-day national level seminar or webinar. And in this present scenario, I like to discuss about the immunomodulator nutrients and COVID-19. And you also know that all of us are also suffering from this pandemic situation about this COVID-19. And from the nutritional point of view, I like to focus that what is the role of the nutritional experts who are working in the different national level institutes like NIN as well as in the different universities for immune enhancement so that the common people can able to fight against that COVID-19. Now, all of you know that this COVID-19 or coronavirus, that is actually enveloped virus, which is 120 nanometer in diameter and having glycoprotein spikes, which is a crown-like virus, and it is single-stranded positive sense RNA virus. There are so many varieties of the coronavirus. Hello, all of the slide is visible. Hello.
Yes, sir. It is visible.
No,
Professor
second
Ghosh, you
slide.
are visible. Yeah.
I have already transferred the second slide. But second
Yes,
slide,
sir.
No, sir,
No.
second side is
No, sir. Second slide has not come, sir. Second slide will not
give
come.
me 1 minute.
And Professor Ghosh, you share full screen. You share with full screen.
I have also full screen. Okay. Hello. Yes.
Now is okay.
Oh, now is okay. Okay. So that is the COVID-19 enveloped virus, 120 nanometer in diameter, and it is a single-stranded positive sense RNA virus. And we have already overcome the second wave, that is the beta variant, and now we are also very much fear about the delta variant as well as the epsilon variant. I am not going in details about that. Okay. Now, what is the relation between the nutrition and health? Now, you know that health is a well-being of the physical dimension, social dimension, mental dimension, and emotional dimension. And health is also explained that it is the adjustment or adaptation to the environment, to the altered environment. And that environment may be the macro or the micro environment. Macro environment, that means the environment outside the organism, and the micro environment, that means the environment within the organism. So when the individual can able to adjust or adapt himself or herself to that altered environment, then it is known as the health is okay. There is a healthy state. And for the maintenance of this healthy state, the proper nutrition, sound nutrition is very much essential. Now, if we go about the relationship between this nutrition and health, then you may say that actually undernutrition as well as the overnutrition can able to interfere the health. And similarly, the deficiency, specific deficiency, not the undernutrition, specific deficiency of the different micronutrients as well as the trace element can able to result the health deterioration. Out of these macro and micronutrients, Professor Srinivas already explained in details about that macronutrients and micronutrients can able to empower that immune activity.
Sir, your presentation is not full screen. Please
No,
shift it to full screen. mode.
If I go to the full screen, then the slide is not actually shared with you. Okay? Because I am also running in another laptop where if we give the full screen, then the slide is not actually scroll in the other laptop, and that I also tested it. I am also testing in another laptop here. This is my laptop, and there is another laptop nearby on the other table. And if we give the full screen, then the slide is not actually scrolled. Okay? And
Okay, sir. Okay, sir.
now in this third COVID-19 wave, which is inevitable, and it is like to hit India within 6 to 8 weeks. So human behavior is the major factor to check this third wave. And out of these human behaviors, there is the social engineering events like physical distancing. It is the most important event of social engineering. Hand washing is also a social engineering step. Mask wearing, symptoms monitoring. So physical distancing, hand washing, mask wearing, and symptoms monitoring. These 4 things are very much important as an essential events for social engineering process to fight against the coming third wave of COVID-19. Besides this, I like to emphasize another human behavior by the alteration of the lifestyle and food style, that is the immuno-boosting. By immuno-boosting, by immune empowerment, by immune enhancement, we can able to strengthen our immune power so that we can able to fight against that third wave of COVID-19 more successfully, and the morbidity rate and the mortality rate may be decreased at a significant level. And for this reason, I give the emphasis on that immunoboosting. And I have already mentioned that undernutrition, overnutrition, and the lifestyle, food style, these are mostly important for that immunoboosting, lifestyle and food style. So nutrient is responsible for immunomodulation, immunoenrichment, and immune empowerment. Macronutrient as well as the micronutrient are very much involved for the modulation, positive modulation of cellular immunity as well as humoral immunity. And today's lecture, I like to give emphasis on special 2 micronutrients, mainly vitamin D and vitamin C. Okay? Now, first one, that why immunomodulation is important in our country. In Indian scenario, why this immunomodulation is very much important. In our country, the healthcare system is not well developed in proportion to that population, human population, that is the Indian demography. Healthcare system is not so developed. And if we go to the doctor ratio, patient ratio, Professor Srinivas already mentioned in details that the health workers, nurse, and the doctors, where the ratio of the doctor's patient is far less than the WHO or the standard norm. So healthcare system is not well developed, and therefore, if we do not defend ourselves by modulation of this food style, lifestyle, we are unable to protect our life because the health infrastructure is unable to give the sufficient healthcare system to fight against that COVID-19. Second one, heavily crowded country. Our country is a heavily crowded country. So by human distancing, we do not know that to what extent we like to give this protection against this coming third wave. And human behavior not able to follow in every time because the awareness level in our community is not so high. So awareness level is not so high. It is of a crowded country. Healthcare system is poor. So if we own self can able to improve our immunity, then It is the most important step for that protection against that COVID-19. And third one, that economical condition of our country or human population, economical condition of the each and every family is not so good. 70% of the Indians are actually suffering from some financial crisis. So they are not able to afford huge amount of money for this COVID-19. So from this aspect, I like to say that immunoboosting, which is responsible most important weapon for the herd immunity, for the community immunity, for the public immunity. And by raising this herd immunity, by immunoboosting, by raising the community immunity, by raising the public immunity, by raising the population immunity, it is the most important way or avenue to fight against that COVID-19. Now, what are the features of immunoboosting? Immunoboosting not an overnight job. That means if we think that if we consume such nutritious food today and tomorrow, and from the next day of the tomorrow, immunoboosting will be noted, it is not possible. It is not an overnight job. Till now, no medicine is available for immunoboosting. Actually, no medicine is responsible for immunoboosting. This immunoboosting is very much helpful against viral infection. For bacterial infection, you know that there are so many antibiotics, but for viral infection, there is no antibiotic. So immunoboosting is the most important way for viral infection like COVID-19. Next one, food style and lifestyle results immunoboosting. So if we increase our awareness level by the modification of the food style and lifestyle, you can able to do this immunoboosting by long-term program, that means few months program. And that immunoboosting is responsible to develop the herd immunity, community immunity, or public immunity. Now, if we study the prevention, disease prevention pyramid, there are actually four hierarchies or four levels: primordial prevention, primary prevention, secondary prevention, and tertiary prevention. And out of these four strata, the primordial and primary prevention, the major two strata, are mainly controlled by non-clinical persons, where the nutritional expert plays an important role for primordial prevention and primary prevention. What is primordial prevention? That means by lifestyle modification, by food style modification, at the pregnancy life, at the lactational life, you can able to improve the health status, nutritional status, immune status of the coming generation. That is the primordial prevention. And in this sector, nutritional experts take an important role, indisputable role, or the clinical person do not contribute in this strata. Primary prevention, that is mainly concerned with IEC, that the information, education, and communication system. With the help of information, education, and communication, you can able to upgrade the knowledge, awareness level of the common people. And by the advancement of the awareness level, you can able to change the attitude of the individuals. Health-friendly attitude can be developed by that information, education, and communication. And when this health-friendly attitude is developed, then health-friendly practices, health-friendly habits, health-friendly behaviors would be noted in our community. And as a result, we can able to introduce the different social engineering events and other immunoboosting events properly, and we can able to fight against this COVID-19 at a definite way. But secondary prevention and tertiary prevention, that is mainly clinical purpose. So in the tertiary prevention, there are some avenues for the non-clinical persons. So that before vaccine development, you know that actually near about 30% of the population, Indian population, has been full vaccinated. Full vaccinated. So there is a huge population which are not in vaccinated about COVID-19. So before vaccine development, before chemotherapeutic drug development against this COVID-19, that immune boosting is very much needed. And that immune boosting can be performed by health education, that can be performed by nutrition intervention program, can be performed by lifestyle and behavioral change, as well as by controlling environmental modification. By proper hygiene, by proper sanitation, you can able to improve your immunity. So these are the 4 avenues by which you can able to empower your immune system. Now, if we study the actually, okay. So I have already mentioned that information, education, and communication can able to change the knowledge, attitude, and practice, and as a result, by that CAF model, the social engineering implementation can be done fruitfully in our community. Now, today I would like to emphasize the vitamin D for public health upgradation with special reference to COVID-19. And you know that vitamin D is not only a vitamin, but it is a hormone. And I like to mention some features of the vitamin D, especially for our students. 70% of daily requirement of the vitamin D can be obtained by sunlight exposure through UVB light, where the wavelength of the UVB is 290 to 350 nanometer. And that skin synthesis of that is the cutaneous synthesis of vitamin D, no cost is required. No cost is required, which is very much fruitful for such developing country like India. Though if you consume the vitamin D capsule, the cost of the vitamin D capsule is very high. It's very high. But due to the lack of awareness, we are unable to synthesize 70% of daily requirement of vitamin D in our cutaneous bed under the exposure of UVB light. It is a cost-free. Number 3, 20 to 30% exposure of the body under sunlight is needed. Not the total body exposure is not needed. Only 20% to 30% of body surface area exposure to the sunlight is sufficient for this vitamin D synthesis, which is 70% of RDA. Now, at what time of the day where the vitamin D synthesis in the cutaneous bed is going on at optimum level? Previously, we have a wrong idea. You know that previously we know that before 8 a.m., if we expose our body and in sunlight, then vitamin D will be synthesized maximally, but it is totally wrong. The vitamin D synthesis under UV light is noted at optimum level from 10 a.m. to 3 p.m. And 15 to 20 minutes exposure is sufficient per day for this vitamin D synthesis. 15 to 20 minutes per day, or 1 to 1.5 hours per week is sufficient. In the dark skin, the individual having dark skin require more time because the melanin is high in the dark skin, which can able to absorb a major fraction of that UVB light. But in case of the fair skin, the time is about 12 to 15 minutes, that is sufficient. But in the dark skin, about 22 to 30 minutes that required per day for this RDA synthesis of vitamin D. From survey report, it has been indicated that 70 to 80% of Indians are suffering from vitamin D deficiency. What is the normal level of vitamin D? That the 25 hydroxycholecalciferol. We do not measure 125 dihydroxycholecalciferol. We measure always 25 hydroxycholecalciferol. That is the calcidiol or calcifediol. And what is the normal level? That is about 20 to 30 nanogram per ml of blood. This is the normal level of 25 hydroxycholecalciferol. But in most of the Indian, about 70 to 80%, it is about 70 to 80% of Indians suffering from vitamin D deficiency. Aged are more susceptible to that deficiency of the vitamin D. And for this reason, if you study the statistics in this COVID second wave, you know that aged individual, that means more than 50 years of age, they are very much affected by vitamin D, than the COVID-19. And their vitamin D is far less than the mid-aged individual, that is the 35 to 45 years aged individual. Why the aged individual having less level of vitamin D? Because they are mainly confined in the room and not exposed to the sunlight. Generally, they are confined in the room. Number two, skin epithelial cell, that is the keratinocyte. Keratinocyte cells are mainly responsible for vitamin D synthesis, which is present at the lowest layer of the epidermis, that is the stratum basale and the stratum spinosum. Stratum basale and stratum spinosum, keratinocyte cells are present, and these cells are responsible for vitamin D synthesis. That keratinocytes activity in the aged individual, especially above the age of the 50, is far less than the 35 to 45 years age. And number three reason, that is the liver activity of that aged individual is less than the mid-aged individual, because the liver is responsible for the hydroxylation of cholecalciferol to 25 hydroxycholecalciferol. So first hydroxylation is noted in hepatocyte cells. And you know that at present, due to that fast food as well as the junk food, Professor Srinivas already mentioned, even in our mid-aged individual and young stage, the vitamin D deficiency is also noted, and that is due to the low hepatic activity, where the cholecalciferol is present, but 25 hydroxycholecalciferol is not at the recommended level. And that is due to the low activity of the liver. I have already mentioned that lowest layer of epidermis, that is the stratum basale and stratum spinosum keratinocytes, are responsible for the synthesis of the pre-vitamin D3, that is the cholecalciferol, from pro-vitamin D3, that is the 7-dehydrocholesterol. So in the keratinocyte cells, 7-dehydrocholesterol is present, and from 7-dehydrocholesterol, that is now the pro-vitamin D3, pre-vitamin D3, that is the cholecalciferol is formed. And that pre-vitamin D3 undergoes hydroxylation, first hydroxylation in the liver, that is 25 hydroxycholecalciferol, and then go to the kidney for 125 dihydroxycholecalciferol. Okay. So if we study that synthesis, 7-dehydrocholesterol, that is the pro-vitamin D3 present in the keratinocyte cells, by photolyzed under UVB, this is photolyzed and from cholecalciferol. Now, if we expose the sunlight, the question may raise that if we expose the sunlight hour after hour, you know that so many workers, daily workers, are also exposed in the agricultural field, hours after hours. So is there a chance of the high level of vitamin D3 and that may result the vitamin D3 toxicity? No. There is no chance of vitamin D3 toxicity, because that is the most important safeguard in our keratinocytes. Because when this cholecalciferol, that is the pre-vitamin D3, is synthesized at the recommended level, then it also results some feedback response. And then 7-dehydrocholesterol is transferred into lumisterol, tecasterol, suprasterol 1 and suprasterol 2. And these are not converted into that pro-vitamin D3. So there is no chance for vitamin D3 toxicity. If we expose to the sunlight hours after hours. So what is the mechanism? Fine mechanism, but we do not know about that. This is the lack of our awareness. If we spread this knowledge to the common people, then it is the most important weapon without any cost to fight against that vitamin D. And this has been proved by the fact that if you go to the workers, daily workers, who are exposed to the sunlight hour after hour, and if you study the incidence rate of the COVID-19 in that community, the incidence rate is very, very low in comparison to that community who are actually confined in multi-storage building. or you may say different complexes, etc. They are mainly suffering from that COVID-19, and that is due to the low level of vitamin D3. The most important cause, not only one cause, but most important. So these cholecalciferol, then the pre-vitamin D3 is converted into 25 hydroxycholecalciferol, I have already mentioned, and the toxicity is noted when this level is more than 150 nanogram per ml. Normal level 20 to 30 nanogram per ml, and when it is more than 150 nanogram per ml, then the toxicity is noted. And vitamin D3 toxicity is very, very dangerous, you know. It can able to increase the calcium. So hypercalcemia in blood is also noted. It results calcification of the different soft tissue. It may result renal problems, especially the renal stone, kidney stone. And the second hydroxylation of this 25 hydroxycholecalciferol, that is in the kidney, that the calcitriol. And you know that calcitriol is mainly responsible for bone function, and it is also responsible for cell proliferation. But the most important non-classical function of the kidney, of the vitamin D, is the immune activity. That we like to focus. Non-classical function of the vitamin D. And this vitamin D binds with the vitamin D receptor, and it is also formed a dimeric complex with RXR, retinoic X receptor. And it can able to bind with the vitamin D response element of the several genes that I like to express later on. And after that, it can able to switch on the specific gene and switch off some other unfriendly genes for this COVID-19. And as a result, it can able to fight against that COVID-19, which is also under nutrigenomics. Now, so it is our idea that renal cells is mainly responsible for second hydroxylation. That is the second step of biotransformation of the vitamin D. But at present, it has been noted that immune cells like T cells, T lymphocytes, B lymphocytes, macrophages, dendritic cells, which are the antigen-presenting cells, are the most important sites for second hydroxylation of vitamin D, and can able to transform 125 dihydroxycholecalciferol, which is the bioactive vitamin cum hormone, and that can able to modulate the several genes for the shifting of pro-inflammatory response to anti-inflammatory response. That I like to focus later on. And as a result, it can able to minimize, neutralize the cytokine storm. And so we can able to protect ourselves from that COVID-19. Because you know that COVID-19 is always associated with the cytokine storm. There is pro-inflammatory cytokine storm. And this pro-inflammatory cytokine storm is responsible for multi-organ failure, MOF. And as a result, renal failure, heart failure, lung failure are noted. But if the vitamin D3 is present and the macrophages can able to convert it into the active vitamin D3, and by nutrigenomics, I like to focus that this vitamin can able to shift the pro-inflammatory response to anti-inflammatory response. And as a result, the cytokine storm will be neutralized, and thereby multi-organ failure can be prevented at a significant level. Now, this potent effect of vitamin D3, that is the 125 dihydroxycholecalciferol, is against the respiratory tract infection. And most of the respiratory tract infections are due to the RNA virus. That the encapsulated RNA virus, like COVID-19, that is a SARS-CoV-2. It had antiviral effects, especially against the enveloped virus, like the COVID-19 virus, that is the SARS-CoV-2 virus. And the most important that I like to mention that through nutrigenomics, this vitamin D3, 125 dihydroxycholecalciferol, can able to upregulate the specific gene, that the catalycidin gene. Catalycidin gene is the most important peptide, catalycidin, against that RNA, single-stranded RNA virus, like SARS-CoV-2 virus. Another gene which is upregulated by that 125 dihydroxycholecalciferol is human beta defensive 2 protein. So human beta defensive 2 gene and catalycidin genes upregulated by that vitamin D3. And these two biomolecules are very much important. to fight against that COVID-19. I like to focus that there are the two arms. If the vitamin D deficiency, if vitamin D is not present in proper way, in proper level, then this side, that the left side, that the pro-inflammatory cytokines level is elevated. For the interleukin 6 is the major one. This is the captain of the pro-inflammatory cytokine team. And it raises the cytokine storm. And that cytokine storm is responsible for most. There's the multi-organ failure, there's the renal failure, heart failure, lungs failure. Okay? But if you go to the other side, here, that if the vitamin D supplementation, that if the vitamin D level is okay, then pro-inflammatory cytokines would be shifted to the anti-inflammatory cytokines. The pro-inflammatory cytokines, that is the T helper cell 1, type 1 helper cell, type 1 helper T cells are responsible for this pro-inflammatory cytokine synthesis. But in presence of vitamin D, the type 2 helper T cells would be activated for the synthesis of anti-inflammatory cytokines like interleukin 4, 5, and 10. And as a result, the multi-organ failure can be minimized. Okay? And these are the vitamin D. You know that the vitamin D also bind with that toll-like receptor that is the co-receptors of the toll-like receptor CD14, and it can able to bind with vitamin D. And that macrophage and the monocytes, polymorphonuclear leukocytes can able to synthesize antimicrobial peptides like cathelicidine, and that is responsible for viral degradation. I like to focus that what are the roles of this cathelicidine and the beta defensive 2 protein. So this is the macrophage that can able to synthesize the cathelicidine under the guidance of vitamin D. There's the vitamin D receptor, and that receptor bind with the RXR. I'm not going in details about that. And it can able to stimulate the vitamin D response element of that cathelicidine gene. And this cathelicidine transcription and translation would be elevated. Then what are the roles of this cathelicidine? Number one, cathelicidine can able to stimulate the chemotaxis process. And due to the chemotaxis, you know that the migration of the different phagocytic cells to the site of injury, to the site of infection would be increased. And as a result, that infected microorganism would be damaged by that microbial cells or phagocytic cells. Number two, this cathelicidine increase the vascular permeability, especially in the capillary bed. And by diapedesis, polymorphonuclear leukocytes, diapedesis, you know, that is the migration of the polymorphonuclear leukocytes, that is the neutrophil, from the vascular bed to the avascular bed through the capillary system. And that is known as diapedesis. This diapedesis is enhanced by this cathelicidine peptide. And another one is that this cathelicidine can able to increase the proliferation of the T lymphocytes, which is the most important key for the cellular immunity. And the B lymphocyte proliferation is also enhanced by that cathelicidine, which is the key of the humoral immunity. So these are the major ways by which vitamin D through cathelicidine can able to improve your immune power, and thereby this immune enhancement is most important to fight against that viral infection. Another one that I like to focus, that the human beta defensive 2 HBD2 peptide under the guidance of vitamin D. And that human beta defensive protein, this is the SARS-CoV-2 virus, or you may say encapsulated single-stranded RNA virus. This HBD, human beta defensive 2 protein, bind with the membrane, bind with the covering of this RNA virus, and it can able to drill along this membrane architecture, and it helps the entry of water, influx of water. And due to the influx of the water, the virus will be burst. Side by side, the membrane would be degraded, and due to the degradation of this membrane, it is unable to proliferate within the host cell or within the host body. So these are the most important ways of the cathelicidine and the human beta defensive protein. And I have already mentioned that pro-inflammation to anti-inflammation, that is the role of the vitamin D, where the anti-inflammatory effect is dominated over the pro-inflammatory effect under the guidance of vitamin D, because vitamin D through its receptor can able to suppress the type 1 helper T cells, and it can able to stimulate the helper type 2 cells, and thereby the anti-inflammatory response would be increased. So these are the actually more molecular level. I do not go details about that. Okay, so these are the different papers about that cathelicidin protein, and that is the vitamin immunology, vitamin D, the most important vitamin D on the immune activity. Vitamin D supplementation may prevent the millions of winter infection, which is mainly conducted by single-stranded RNA virus. Okay. Now, the zinc, another immunomodulator, that is the zinc. So zinc has also the antiviral activity. It also inhibits the binding of the virus on the target cell receptor. You know that the COVID-19 binds with the pulmonary epithelial cells to the toll-like receptors. And the specific receptor is known as, you know, that the angiotensin converting enzyme receptor. And the affinity of this COVID-19 SARS-CoV-2 virus with that receptor is inhibited in presence of zinc. It interferes the viral uncoating. It is interfered. And if you inhibit this viral uncoating, then viral proliferation, viral replication in the host cells can be minimized. It also inhibits the viral genome transcription. Zinc also inhibits this viral genome transcription. And thereby, the different viral protein would not be synthesized and show the replication cycle in the virus in the host cell would be inhibited. It also inhibits the proteases and the polymerase enzymatic process, and as a result, the viral infection can be minimized by this zinc. And you know that zinc is also present in huge amount in onion, in the garlic, okay? And these are the most important zinc, and the different flesh, that is the higher mammals. Flesh of the higher mammals also contain the high level of the zinc. Okay. Now, if we study the zinc, then it also finds the zinc finger protein, and this zinc finger protein can able to inhibit the nuclear factor kappa B activation. And due to this nuclear factor kappa B activation, which is the transcription factor, it can able to suppress the pro-inflammatory gene expression. And it can able to stimulate the anti-inflammatory gene expression. Side by side, zinc is also the stimulator of the antioxidant enzyme, that is the superoxide dismutase enzyme. And as a result, oxidative stress can be minimized. So oxidative stress can be managed, and as a result, we can able to fight against that viral infection. So next one that I like to focus to some extent about that vitamin C. Vitamin C has a huge role on that immune empowerment. And you know that vitamin C is also present in broccoli, in the lemon, okay, in the amla. There are so many green vegetables also contain the vitamin C. And this vitamin C, even in guava, that is also the vitamin C is also present. This vitamin C also inhibits the apoptosis of the T lymphocytes. You know apoptosis, that is the programmed cell death. So this vitamin C can able to prevent the apoptosis of the T lymphocytes, because it can able to suppress the pro-apoptotic gene expression. It can able to suppress the pro-apoptotic gene expression, like the BAX gene, and it prevents the anti-apoptotic. It can able to enhance the anti-apoptotic gene expression, like the BCL2. So by that balanced system of pro-apoptosis and anti-apoptosis, T lymphocyte proliferation can be maintained by the vitamin C. So this is the most important role. It also enhances the production of the nitrogen oxide, NOx, nitrogen oxide. And this nitrogen oxide, you know, that is the gaseous hormone. It is the gaseous hormone which is present in what? Blood. And it is synthesized in the endothelial cells, tunica intima of the blood vessels. Tunica intima endothelial cells. And this nitrogen oxide is responsible for vasodilation. And due to the vasodilation, the rate of circulation of the blood flow to the infectious zone would be increased, and thereby we can able to supply the most of the maximum number of the phagocytic cells to that zone, and as a result, the fighting against that virus can be performed in optimum level. Another role, that is the neuraminidase. It can able to inhibit the neuraminidase. The neuraminidase is the most important enzyme which is responsible for destruction of the sialic acid. And if the neuraminidase is high, then the viral replication would be elevated. But vitamin C, through genomic as well as the non-genomic way, can able to suppress the neuraminidase. And as a result, the sialic acid breakdown, the cleavage of the sialic acid along the membrane of this virus is not noted properly, and thereby the viral replication cycle is interrupted. So there are so many ways of the vitamin C by which we can able to increase our immunity. Now, if we go to that RDA, the zinc RDA, that is about adult 11 mg and in female 8 mg, vitamin C requirement in the adult, that is the 90 mg to 75 mg, male and the female, and the vitamin D, that is about 600 IU or 15 microgram level. And I have already mentioned that the normal level, that is about less than 30 nanomole per liter or less than 12 nanogram per ml. And it is toxic when it is more than 50. And more toxicity is noted, that the renal stone is noted. Renal stone is noted, vomiting tendency is noted, soft tissue calcification is noted when the vitamin D level is more than 150 nanogram per ml, which is the toxicity, which is the vitamin D toxicity. But generally, that vitamin D toxicity by skin, by sunlight exposure is not noted due to such protection that I have already mentioned. Now, diabetes, we all know that diabetes, if the diabetic person are affected by COVID-19, then mortality rate is very high. Why? I like to give some explanation that AC, that is the angiotensin converting enzyme receptor amplification is increased due to the hyperglycemic condition. In normoglycemic condition, if you study the AC receptor population density along the alveolar epithelial cells, their number is comparatively less. And if the receptors number are less, then the rate of infection, the probability of infection by SARS-CoV-2 virus to that alveoli would be decreased. Hyperglycemia can able to amplify this receptor, and as a result, the SARS-CoV-2 virus are easily bind with that receptor, and that can able to infect the pulmonary cells. Another point is that due to the high level of glucose, it binds with the protein along the membrane of the tunica intima. These are the blood vessels. And this protein, this thread are the protein, and the red color, that the glucose, and that is not the glycation, that the glucose area to the protein along the luminal surface of the blood vessel. And as a result, the vascular endothelium becomes narrow. And that narrowness is also noted in the pulmonary vascular bed, and thereby the oxygen saturation is decreased due to the COVID-19 infection. And that saturation is decreased drastically if the individual is already suffering from the diabetes. Side by side, in diabetic individuals, you know that immune cells may utilize fat for energy production instead of glucose, because the glucose are not utilized in that diabetic individual. So immune cells, when you utilize excess fat for energy production, then acidic environment is noted in the immune cells. And that acidic environment interferes the proliferation of the T lymphocytes, B lymphocytes, and thereby the population density will be decreased. Macrophage activity, diabetes, and the phagocytic activity all are decreased due to that acidic environment of these cells, So these are the most important aspects why morbidity and mortality are very high in case of the diabetic individual if they are infected by COVID-19. And these are I have already mentioned that immunoboosting diet pattern. So you must follow that diet pattern. That should be immunoboosting diet pattern. That means we consume green vegetables, root vegetables, fruits, green tea, honey, fiber-rich food. These are the immuno-boosting diet. And we will try to avoid the immuno-weakening or immuno-killing diet pattern. That's the fast food. Professor Srinivas, you already mentioned that fast food, junk food, preserved food, processed food, all are immuno-weakening foodstuffs. And another one, lifestyle, that healthy lifestyle, that is walking 30 minutes per day, that should be followed. Sleep 7 to 8 hours per day. And because this proper sleep is very much essential for neuroendocrine immuno-axis, cooperation. There is a nexus among this neural system, endocrine system, and immune system is noted at the sleeping state, because at that time, different brain monoamines are released, and that brain monoamines are responsible for immunoactivity under the guidance of endocrine system and neural system. Timely eating, timely wake up, timely sleep, these are very much important, because biorhythms, in our body, biorhythms are going on, which is under chronobiology. So if you go to 8 hours sleep, suppose from 3 a.m. to 10 a.m., it is not the healthy sleep, though the duration is same. If you sleep after 10 p.m. to 6 a.m., this is the ideal period of the sleep. And if you sleep in that period, then our brain monoamines can able to execute their function properly on the three system, and it also favorable for immunoboosting. Unhealthy lifestyle, that the physical inactivity, minimum sleep, irregular sleep, anxiety and awareness, irregular food eating pattern, all are unhealthy lifestyle. So we must follow the healthy food style, healthy lifestyle, and as a result, we can able to fight against that COVID-19. I have already mentioned that herd immunity. That herd immunity, that means the population immunity. That means the community immunity. That means the public immunity. What is herd immunity? How we can achieve? There is no medicine for herd immunity. Vaccine not available as per demand. Diet pattern, it is our hand. We can able to modulate the diet pattern for immunoboosting. Social engineering within our hand. We also follow the masking. We also follow the social distancing, etc., etc. And gradual, and if the immunoboosting is noted, and that what is the percentage of immunoboosting in case of herd immunity? In case of the COVID-19, it has been noted that if 75 to 80% population are immune against that COVID-19, then it is the herd immunity against COVID-19. Because herd immunity percentage of immunized person in the community is not same in all the disease. In case of COVID-19, it has been predicted that 75% to 80% of the community members are immunized against this COVID-19 by natural way or by vaccinated, whatsoever. Then we can able to fight against that COVID-19. This is the community one. This is the first stage. Here, there is no immune person. There is no immunized person. Red are actually affected and black are normal. After few weeks, the second community, that the second stage is noted, where some green circles are noted, and that green circles indicate that is the immunized person against this COVID-19. And community 3, that is where the number of that immunized person has been increased drastically. And as a result, the degree of spreading in the first stage is very high, but when the immunized person has been increased, the degree of spreading has been decreased, and in the third stage, the degree of spreading is very, very low. So this is the most important process for herd immunity. And this is another model of the herd immunity, that is in the first stage, in the second stage, then the yellow color, these are the immunized person. So by this food style and lifestyle modification, for few months, you can able to immunize. Side by side, vaccination is going on. So by this joint effort, I hope that, most of all of us also hope that we can able to achieve this herd immunity within few weeks, and we can able to fight the third wave, which is coming within few weeks as per expectation of the different scientists. So our slogan is not fear but hope. Fear is the most important. Fear is the most harmful factor for that immuno empowerment. It also prevents the immune empowerment. Because in fear, the reactive oxygen species has been increased. Anxious stage, it also elevates the reactive oxygen species, and due to the reactive oxygen species, actually the proliferation of the T cell, B cells are not noted properly. Even in that fear stage or in this anxious stage, you know that sympathetic activity is also elevated, and that sympathetic activity also interferes the hepatic activity, and that also interferes the hydroxylase of the vitamin D. Second slogan, the biggest virus is not the coronavirus but fear. And third slogan, our duty to stop panic. Okay, so this is all about that immunoboosting to fight against that COVID-19, this pandemic situation. I offer my heartiest thanks to all of you. Okay, so thank you.
Thank you, sir.
For your valuable thoughts. We feel blessed to have you today in this webinar. Our knowledge is enriched with your deep thoughts on the said topic. Now it's open to question sessions. So, have anyone any questions on this topic?
That's the one. So any question? Hello, Sukant Babu. Sukant Babu, good day. Sukant Babu.
গুড আফটারনুন স্যার।
Okay, good afternoon.
হ্যাঁ, ভালো আছেন তো?
হ্যাঁ, ভালো আছি। আপনি আমাদের ইনভাইটেশন গ্রহণ করেছেন। আপনি আমাদের ইনভাইটেশন গ্রহণ করেছেন, আমরা কৃতজ্ঞ আপনার কাছে।
না 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 না, বলুন। এমনি সব ঠিক আছে তো?
হ্যাঁ, ঠিক আছে, ঠিক আছে, ঠিক আছে।
আচ্ছা, ঠিক আছে স্যার, খুব সুন্দর হয়েছে প্রেজেন্টেশনটা।
ছেলেদের স্বার্থে একটু যদি আমরা চাইছি অ্যাওয়ারনেসটা বাড়াতে আর কি, অ্যাওয়ারনেসটা বাড়িয়ে। হ্যাঁ,
খুব সুন্দর হয়েছে স্যার।
There is a question.
হ্যাঁ, বলো বলো বলো।
There is a question from Amol Kumar Molik that sir, 1 second. COVID virus can reduce level of D3.
COVID virus reduce D3. Actually, that COVID virus results, I have already mentioned that it also results the pro-inflammation, cytokine storm. And that pro-inflammatory cytokines can able to damage the different visceral organs, not only the kidney, not only the heart, not only the lungs, but also liver. And due to the interference of the hepatic activity, the hydroxylation of the vitamin D, then the cholecalciferol to 25 hydroxycholecalciferol would be interrupted. So due to such interference of this first hydroxylation of the cholecalciferol, the vitamin D3, that is that 125 dihydroxycholecalciferol would not be achieved to the normal level, to the desirable level, and so the consequences that I have already mentioned would not be operated in proper way. So in that sense, we may say that COVID-19 severe infection also interfere the biotransformation of vitamin D, biotransformation of vitamin D. Okay?
Okay, sir. Thank you. Have anyone any questions? Sir, another question from Sanjay Bera. What is herd immunity? Please.
Herd immunity আমি যেটা বলেছি, herd immunity মানে পপুলেশন ইমিউনিটি, মানে আমাদের পপুলেশনের কত পার্সেন্ট ওই ডিজিজের এগেইনস্টে ইমিউনাইজড হয়ে গেছে। যেমন আমরা বললাম বিভিন্ন রোগের ক্ষেত্রে এই ইমিউনিটি পার্সেন্টেজ অফ ইমিউনাইজ পার্সেন্টেজ আলাদা আলাদা হয়। কোভিড-19 ক্ষেত্রে আমাদের যে সমস্ত সায়েন্টিস্টরা, ম্যাথমেটিশিয়ানরা রয়েছেন এবং তারা মডেলিং তৈরি করছেন, তারা বলেছেন যে 75 to 80% যদি আমাদের কমিউনিটি মেম্বাররা ইমিউনাইজড হয়ে যায় এগেইনস্ট কোভিড-19, তার দ্বারা বাই ইমিউনো বুস্টিং or by vaccination program, then we can able to resist against this COVID-19. That is the herd immunity, population immunity. Community থাকবে, COVID-19 থাকবে, আমরা ওই COVID-19 নিয়ে থাকবো, আমাদের কিছু হবে না, আমাদের কিছু হবে না। That is the herd immunity.
Yes, sir. Thank you, sir. Anyone have any questions?
ঠিক আছে, সুকান্ত বাবু দেরি হয়ে যাবে, সুকান্ত বাবুকে দিয়ে করো।
Sir, another question. What is T cell?
হ্যাঁ,
from what is T cell from Amol Kumar Molik.
Oh,
Another
lymphocytes, you know, lymphocytes আমরা বলছি, lymphocytes আমাদের ছাত্র তো ছাত্র
no sir.
আচ্ছা যাই হোক, আমি বাংলায় বলছি,
Your
আমাদের
microphone, please.
ছাত্ররা যাতে জানতে পারবে। লিম্ফোসাইট দু ধরনের হয়, যারা থাইমাসে প্রসেসড হয়, থাইমাসে চার্জড হয়, থাইমাসে ডিফারেন্সিয়েশন হয়, থাইমাসের জন্য তাদের বলা হয় টি লিম্ফোসাইট। থাইমাস PHY, তার জন্য টি লিম্ফোসাইট। এবং এই টি লিম্ফোসাইটসটা আমাদের অনেক ধরনের টি লিম্ফোসাইটস রয়েছে, যেমন কিলার টি লিম্ফোসাইটস, মেমোরি টি লিম্ফোসাইটস, সাপ্রেসার টি লিম্ফোসাইটস। হ্যাঁ, so these are the several helper T lymphocytes. Helper are about type 1, type 2. So there are so many types of T lymphocytes. এই T lymphocytesটা আমাদের সেলুলার ইমিউনিটি দুটো পার্ট, সেলুলার ইমিউনিটি এন্ড হিউমারাল ইমিউনিটি। সেলুলার ইমিউনিটিকে মেইনলি কন্ট্রোল করে T lymphocytes। কেমন? আরেকটা লিম্ফোসাইট যেটাকে বলা হয় বি লিম্ফোসাইট, অ্যাকচুয়ালি বি লিম্ফোসাইট প্রসেসড, চার্জড এবং ডিফারেন্সিয়েটেড হয়েছিল, প্রথম আবিষ্কার হয়েছিল বার্সের ক্লোয়াকাতে। একটা লিম্ফাটিক টিস্যু রয়েছে, তাকে বলে বার্সা ফ্যাব্রিস। এই বার্সা ফ্যাব্রিস যে বিতে হয়েছিল বলে বি লিম্ফোসাইট নাম দেওয়া হয়েছিল। কিন্তু আমাদের তো বার্সা নেই, আমাদের কোথায় প্রসেস হয়? আমাদের বোন ম্যারোতেই প্রসেস হয় বি লিম্ফোসাইট। And these B lymphocytes are confined to the plasma cells, and that plasma cells are responsible for the synthesis of immunoglobulins. And you know that there are 5 types of immunoglobulins: IgA, IgD, IgE, IgM, IgE. এই immunoglobulins, these are the most important part of the humoral immunity or acellular immunity. তাহলে একটা কোষীয় অনাক্রম্যতা, একটা অকোষীয় অনাক্রম্যতা। এই কোষীয় অনাক্রম্যতার জন্য দায়ী হচ্ছে টি লিম্ফোসাইটস, আর অকোষীয় অনাক্রম্যতা যেটা বায়োমলিকুল দিয়ে হবে, যেমন ইমিউনোগ্লোবুলিন দিয়ে হতে পারে, যেমন কমপ্লিমেন্ট দিয়ে হতে পারে, যেমন ইন্টারফেরন দিয়ে হতে পারে, যেমন সাইটোকাইনস দিয়ে হতে পারে, ইন্টারলিউকিন দিয়ে হতে পারে। এইগুলো সবই হচ্ছে বায়োমলিকুল। তারা যেটা করছে, এই যে আমরা যেটা বললাম ক্যাথলিসিডিন, হ্যাঁ, তারপরে হচ্ছে হিউম্যান বিটা ডিফেন্সিভ প্রোটিন, অল আর বায়োমলিকুলস। দিস আর অল আন্ডার হিউমারাল ইমিউনিটি। হ্যাঁ,
Yes sir. Yes. Thank you sir.
ওকে, থ্যাংক ইউ।
So now we are moved into the technical session 2, and now may I request Dr. Shukantu Mondol, Principal Scientist, Animal Physiology Division, ICAR, National Institute of Animal Nutrition and Physiology, Bangalore, to start the second technical session of the day with his topic, Impact of Heat Stress and Nutritional Stress on Early Embryonic Survival. Dr. Shukantu Mondol is currently working as Principal Scientist at ICAR, National Institute of Animal Nutrition and Physiology, Bangalore, India. He completed his PhD in 2006 from Indian Veterinary Research Institute, Bareilly. He has been working in the field of genomics of hormones, reproduction, and stress for last 24 years. His major research interest includes CRISPR and Cas9 based editing of genes regulating early embryonic survival, cloning and expression of genes regulating early embryonic loss, impact of stress on maternal recognition of pregnancy, understanding the mechanism of action of hormone on the reproductive tract, understanding the mechanism that regulate ovarian follicular development, etc. He has published 132 research publications, written 13 book chapters, and edited 3 books published by Elsevier. His pioneering contribution in genomics has received prestigious awards like Overseas Associationship Award by Department of Biotechnology, Government of India, Professor G.P. Talwar Medicareer Scientist Award, Professor G.K. Pal Award, Siri Research Award, Dr. K. Anji Reddy Award, Professor P.V. Shen Memorial Origin Award, and ISSRF Young Scientist Award, etc. Over to you, sir.
Good afternoon to all. First of all, I welcome all of you for this topic on impact of heat stress and nutritional stress on early embryonic survival. At the outset, I would like to express my sincere gratitude to the principal sir, Dr. Fotik Boron Mondal, Dr. Rajkumar Maiti, and other organizers for giving me an opportunity to talk before the students. Now we know that early embryonic mortality is one of the major reproductive problems. And this early embryonic mortality and aberrant maternal recognition of pregnancy mainly cause 33% pregnancy failure in cattle and buffaloes. So majority of these losses occur because of the failure of dialogue between the mother and the conceptors. Now, what is actually embryonic mortality and their categorization? Generally, embryonic mortality is categorized into three categories. One is the early embryonic mortality, second category is late embryonic mortality, and the third category is fetal loss. Now, early embryonic mortality means the mortality which occurs before day 28 of the gestation, and it does not affect the length of the cycle, and there are no signs of abortions are diagnosed. Second category is late embryonic mortality, which occurs between days 28 to 42 of the gestation. It is diagnosable because in some cases the embryo and membranes are aborted, and the obvious sign is the animal will return to the estrus. And the third category is the fetal loss, which occurs after day 42 of the pregnancy. Now coming to the early embryonic development, generally day 0 is considered as a day of fertilization. And then the fertilized embryo reached 2-cell stage on day 1, and it subsequently reached to 4-cell stage around day 1.5, and subsequently to blastocyst by days 7 to 12, followed by elongated blastocyst by days 13 to day 35 of the pregnancy. And it has been observed approximately 35% losses are recorded between day 0 and day 30 of the pregnancy. Now, if we see the stages of the embryonic development and cumulative losses, it has been observed there are 10% losses on day 0 of the pregnancy. That is the estrus and the fertilization, 10% losses. 30% losses occur between day 3 to day 7 of the pregnancy. And majority of the losses, that is 40% losses, are recorded between day 8 and day 16 of the pregnancy. And I think all of you must have heard about the maternal recognition of the pregnancy. What is maternal recognition of the pregnancy? It is nothing but the mother knows that she is pregnant. So some signal, that molecule, some signaling molecule is released by the conceptors, so that mother can recognize that, okay, she is pregnant like that. So that period is called the maternal recognition of pregnancy. And that varies from day 40 to day 17 of the pregnancy. In different animals, different days are there. Particularly sheep and goat, it is 1 or 2 days. But in case of cattle, it is day 16 to day 19 of the pregnancy. Now the question comes, why early embryonic loss is a concern? Because firstly, there is loss of viable offspring and their production. Secondly, increased maintenance cost of the animal. Thirdly, it hampers the genetic progress. And fourthly, it hampers the advances in assisted reproductive technologies. Now coming to the causes of the embryonic mortality, mainly the losses are taking place because of genetic abnormalities. Secondly, nutritional stress. Thirdly, abnormal uterine environment. Fourthly, inappropriate insemination. Fifthly, reproductive management program. Sixthly, endocrine imbalance. And lastly, the thermal stress, because these are the main causative factors for the embryonic mortality. Now I will discuss one by one all the causative factors. The first important thing is genetics. Mainly, genetic abnormalities cause 5 to 10% losses, and this loss occurs between first 2 weeks of the pregnancy. What happens when there is an abnormal chromosomal number? So there will be abnormal growth of the embryo and death within the first trimester of the gestation. Tetraploid cell in the blastocyst stage at day 12 to day 16, it causes the chromosomal defect, ultimately leads to the embryonic mortality. Now the second important cause is heat stress. Mainly 10% loss is caused by the heat stress, and that too before day 25 of the pregnancy. Generally, it has been observed that if the cows during early stages of follicular development, if they are exposed to heat stress, it hampers the oocyte quality and the subsequent embryo development. Hoagland and Whitman, they reported that in vivo heat stress, if the animal is pregnant, suppose between day 8 and day 69, and if the animals are exposed to heat stress, so there will be more concentration of the prostaglandin F metabolite, and this prostaglandin F metabolite, what it causes? It causes regression of the corpus luteum. So ultimately, the embryo comes out from the mother's womb. Now this diagram explains what happens during heat stress. Generally when there is heat stress, so what will happen? Animal will consume less dry matter, which ultimately leads to the negative energy balance. And because of negative energy balance, there will be decreased GnRH and LH release from the pituitary gland, and because of that, low estradiol production by the ovary, leading to poor estrus expression and poor quality of the for the embryo development and other sperm DNA condensation ovulation. They are required for there is heat stress, so there will be more production of reactive oxygen species, and that reactive oxygen species cause cellular damage and also inhibit the embryonic development. Now coming to the third important cause is the nutritional stress. Generally, the cows will have less embryo mortality if they gain body condition during pregnancy. But if animals lose body condition during pregnancy, so the tendency of the loss stress affect the feed intake, water intake, respiration rate, and the rectal temperature. Sometimes it has been observed some farmers they feed high protein diet or some owners, but it is very harmful during pregnancy. If we feed too much protein diet, proteinaceous diet, there will be more production of ammonia and urea, which will interfere with the normal inductive action of the progesterone. So what will happen? This progesterone, because of the interference in the progesterone action, the uterine microenvironment will not be suitable for the embryonic development. So what will happen? Ultimately, the rejection of the embryo will take place. Now, inappropriate insemination is the insemination at the proper time is also an important factor. So the insemination should be done at proper time. Generally, if we do insemination at early stage, what will happen? The embryo quality will be very high, but the fertilization rate will be low. Subsequently, if we do insemination at later stage, the embryo quality will be low, but the embryonic losses will be there. Now, the hormonal imbalance. We all know that progesterone is an important hormone which maintains pregnancy. And there are two major reasons of lack of progesterone. If there is lack of progesterone during pregnancy, so the losses will be more. Why the lack of progesterone is there? Because sometimes what happens, we'll be having short lifespan. So what will happen? Because of short lifespan, the luteolysis will occur before the embryo sends the signal for its presence. And secondly, the corpus luteum, they are having the normal lifespan, but they will secrete low level of progesterone, so it cannot suppress the luteolytic effect of the prostaglandin. Even we have seen in case of buffalo, if there is inadequate luteal function during pregnancy, so the embryonic losses are more in case of buffalo. Infectious agent is another important factor. If we shoot the various infectious agents like Corynebacterium pyogen, Vibrio, Brucella abortus, and bovine herpes virus, they mainly cause the embryonic. These are the important infectious agents and they cause the embryonic losses. Another important factor is the asynchrony between the conceptus and the maternal system. When there is failure of signaling between the mother and the conceptus, so there will be loss, and that period is called the maternal recognition of pregnancy. In case of cattle, the maternal recognition. Now what happens? When the animal is pregnant, there will be corpus luteum on the ovary. So that corpus luteum will secrete progesterone, and that progesterone prevents the production of prostaglandin F12. Similarly, the embryo-derived signal that is called interferon tau. So thereby the pregnancy is maintained. Now this is the biosynthetic pathway of the prostaglandin biosynthetic pathway. Generally, prostaglandin is synthesized from the arachidonic acid, and this arachidonic acid gets converted into PGH2 under the influence of COX2. Then PGH2 gets converted into PGF2 alpha under the influence of prostaglandin F synthase. Similarly, prostaglandin H2 gets also converted into that are mainly intronless gene, and it is 585 base pair open reading frame, and in different species buffalo it has been observed 99% similarity at nucleotide level and nearly 100% at the amino acid level. Prostaglandin E synthase, just now I told it is another because there are two fractions of the prostaglandin. One is cytosolic and the microsomal fraction, and the gene is 14.8 kb, which is located on chromosome number 9. 3 exon and 2 introns, and the open reading frame is 462 base pair. cDNA for cattle, buffalo, pig, horse, human, and buffalo we have done available. Even expression profile also studied in uterus, placenta, corpus luteum, and ovary, and this PGES expression was moderate on day 1 to day 3 of the cycle. It was low on day 4 to day 12, and high on day 13 to day 21 of the cycle. Now, prostaglandin F synthase also, this gene is, the size of the gene is 11.597 kb, located on chromosome number 10, consists of 9 exon and 8 intron, and open reading frame is 972 base pair. cDNA has been sequenced for cattle, horse, human, monkey, pig, and buffalo. The expression has been studied, and it was observed that the PGFS expression decreased following administration of oxytocin. Now, osteopontin is another important gene, which is 837 base pair. It is of 278 amino acid, and this gene contains GRGDS sequence. This particular sequence promotes cell-to-cell attachment and the cell spreading in the mother's uterus. Prolactin also is another important gene, and this expression was low on invasion. Now, coming to our results on the effect of heat stress and nutritional stress on maturation of estrus, of course, it significantly decreased. But the hormone like cortisol and progesterone increase. Estradiol level, it significantly decreased following heat stress. Then we studied those maternal recognition of pregnancy related gene following heat stress. What we did, we inserted progesterone sponge inside the vagina of the animal sieve, and that particular sponge was taken out around after day 12. On that same day, we injected PMSG. PMSG is nothing but which is having the FSH-like activity, so that the follicular growth takes place. After that, the animal hand mating was done, and after hand mating, what happened? The animals were kept in the climatic chamber where we followed the 6-hour model, and then we collected embryo on day 11, day 13, and day 15 of the pregnancy inside the climatic chamber where the animals were exposed to heat stress. And we found, very interestingly, we found that PGES expression decreased in all days, day 11, day 13, and day 15. But prostaglandin F synthase expression, it decreased on day 11, but it increased day 13 and day 15 after heat stress. What does it indicate? It indicates that because of heat stress, there was upregulation of the PGFS gene, and because of upregulation of the PGFS gene, the embryonic losses took place in sieve. In addition, we also studied the effect of nutritional stress on ovulation rate, fertility, and embryo production in superovulated sieve. So we took 8 animal in control group and 8 animal in nutritional stress group. What was our nutritional stress model? We just restricted 30% diet. Whatever we are giving to the control animal maintenance diet, we just restricted. We gave only 70% of that diet. And what we found, that the ovarian response was low, but in nutritional stress, although it was higher, but it was not significant. But the most interestingly, we found that the embryo recovery was significantly lower in the nutritional stress group. That means nutritional stress is having a lot of impact on the embryo survivability. We studied COX-2, PGFS, HSP, inducible nitric oxide synthase gene SERPIN expression, and we found there was increase, but it was non-significant increase of this gene. Whereas PGES, osteopontin, and MX protein, it decreased. Now, the most interesting, we found that the PGES expression, it must be high during pregnancy. But what happened? In nutritional stress group, it is low. So in nutritional stress group, the losses is happening because of decreased expression of PGES gene and increased expression of prostaglandin F synthase gene. So these are the mainly two culprit gene, which is mainly causing a role in embryo survivability. We have also studied the effect of combined stress, like combined heat and nutritional stress on ovarian response and embryo production. Similarly, we found that the embryo recovery was significantly lower in combined stress group as compared to the control group. We studied the expression of COX-2, PGES, integrin, galactin, HSP, and PGFS gene. See, interestingly, we found that the COX-2 gene expression was low. PGES, these two genes are very, very essential for maintaining the pregnancy. If this gene expression is low, how the animal can maintain the pregnancy? The pregnancy cannot be maintained because of the lower expression of COX-2 and PGES expression. On the contrary, we found the PGFS expression is more. So this PGFS expression is creating problem, and because of that, luteolysis is happening and the embryo are coming out from the mother's womb because of the increased expression of the PGFS mRNA. We have also studied the effect of heat stress on sick oocyte maturation. So control oocytes were exposed to 38 degrees for 20 hours in heat stress group. We had two groups where we exposed, one group exposed to 40.5 degrees centigrade for 18 hours, other group 42.5 degrees centigrade for 18 hours. And we found in control group, the maturation rate was 70%, but in 40.5 degree group, it was significantly low of 52% as compared to the 71% in control group. Even in the group 2, that is 42.5 degree stress group, it was only 15, which was highly significant at 1% level. So these are some of the representative quality of the excellent oocytes, where it is having more than 4 to 6 layer of oocytes, good and dark, and the shape is becoming asymmetrical. Sometimes the cumulus layer, it is clearly indicated from the figure, the cumulus layers are dispersed after heat stress. Here it is fully degenerated, it became black, and the cumulus cell, it got degenerated, fully degenerated. And the last figure you are seeing, it is a shrunken rootplasm. Then we studied some of the biochemical parameters which are mainly involved in growth and development of the oocyte. We studied protein, glucose, calcium, phosphorus, chloride, and urea, and we found all these things were low following heat stress as compared to the control oocytes. Now coming to this impact of heat stress on buffalo endometrial cell, also similarly, the endometrial cells were exposed to only one temperature, that is 40.5 degree for 18 hours, and the control group was exposed to 38.5. And then we collected the endometrial cell at 0, 3, 6, 12 or 24 hours from the control animal and heat stress cell. Then we studied the different gene expression, and we found the COX-2 expression was higher around day 24. PGS expression was also higher in heat stress group as compared to the control group. Similarly, PGFS also was higher as compared to the control group. Integrin and galactin gene expression also slightly higher than the control group. Then we studied the impact of heat stress on buffalo oocytes and embryos. So the oocytes on when they were in the maturation stage, generally 0 to 4 hours of maturation, we exposed them to room temperature 40 to 42 degree. 8 to 12 hours of maturation, they were exposed to same temperature, and then 16 to 20 hours of maturation they are exposed, and then after fertilization also 0 to 4 hours, and then 72 to 76 hours they were exposed to these two different temperature of 40 and 42, and then we studied, we were seeing that their blastocysts, that the cell count has significantly decreased in control animal group 2, which were exposed to 42 degree, and the other group, that is the which were exposed to 42 degree, there was significant decrease in the trophoblastic cell count. Then we studied some of the gene expression like heat stress gene, and we found HSPA, C-twin and MNS superoxide dismutase also increased immediately during heat stress. Whereas maternal embryonic transition gene like PAP, U2F and E1F1A also, it significantly decreased in 8 to 16 cell stage and morula stage. Then we studied the maternal pregnancy related gene like TET4, CTX2, GATA3 and interferon TAR. All the genes decrease in the morula and blastocyst stage, and there was significant decrease. So it means that heat stress mainly caused mainly affecting the MRP related gene, and because of that embryonic losses are happening. Now coming to the strategies, what are the strategies we can take up so that we can minimize the embryonic losses? First is the optimum insemination timing, first strategy. Second strategy is nutritional strategy. Third strategy is the hormonal therapy, like in use of progesterone. Fourth one is exogenous administration of luteotropic agent, and the fifth one is use of bovine somatropin. And the Obstinge protocol. This is the first synchronization protocol developed, and it got very much popularized, where the injections of PGF12 and GnRH after GnRH was injected, so the follicle, and then after 10 to 20 hours of GnRH injection, the animals were inseminated. So this is the Obstinge protocol, and we found it was very, very effective, and the embryonic loss was very less whenever we are following this Obstinge protocol. Now, subsequently, there was a modification of this Obstinge protocol, where two PGF12 injection were given at 14 days apart, and they are administered 12 days before initiation of the Obstinge protocol. So this is the thing. So this is the Obstinge protocol, GnRH, PG, and GnRH. So before that, 12 days before, we have given them 2 injection of PGF2 alpha. And then the rest of the protocols we followed, and we found there was significant decrease in the embryonic losses. Number of services per conception also decreased. Now the third is administration of hormones like progesterone. The pregnancy rates were increased 30% by use of progesterone releasing intravaginal devices. So this Robinson, he conducted some experiment, and he found there was pregnancy rate improved 30%. Pregnancy rate improved 30%. Heat stress and nutritional stress and combined stress modulated the expression profiling of genes, which regulate the maternal recognition of pregnancy and implantation. Heat stress also affected the growth and maturation of sepocyte by altering the ionic and mid-maturation phase, that is 8 to 12 hours of maturation. And the embryo exposed to 72 to 76 hour post-insemination, it hampers the blastocyst and hatch blastocyst development rate in buffalo. So lastly, I would like to acknowledge my funding agency, of course, the National Fund, who gave huge money for this one. And the Assistant Director General, Dr. Raghaval sir, who helped us and who meticulously observed and who did monitored our project and all those things. And lastly, Principal sir, Dr. Kotik Baran Mandal, and Dr. Rajkumar Maiti, Dr. Devidas Ghosh, and other organizer. And next is my directors and India, my partner institute director, and my co-associates like Dr. Malakar, Dr. Das, Dr. Datta, Dr. D. Kumar, and students like Dr. Dipankar and Dr. Praveen, because whatever I am today, it is because of their help only we could able to achieve all these objectives. Thank you.
Thank you, sir, for giving your valuable insights on impact on heat stress and nutritional stress on early embryonic survival. Now this is question answer session. If anyone have any question. Any questions?
Hello.
No, sir. There is seems like no questions. Thank you. Thank you.
Okay, thank you very much.
Now we are almost towards the end for webinar, and I would turn colleague Tultul Chaudhary, Faculty of Nutrition, Nutrition, for the vote of thanks to everyone here.
Okay. Good afternoon to all. We sincerely hope that all of you thoroughly enjoyed the informative and valuable discussion in this webinar. Now this is time express our heartfelt gratitude to all members of this webinar connected online. This has been really a great pleasure for me that I, Tulsi Chaudhary, on behalf of my institute, Bankura Christian College, and my entire team members of this webinar, we like to express my hearty gratitude to all the members of this webinar and all our dignitaries. I would like to express my thankful gratitude to Dr. Srinivas Rao Jarapala for his valuable and informative speech on the malnutrition related problems in India, which has really been among the rudimentary problems in our country. Thank you, sir. Thank you for being part of this webinar and adding Professor Devidas Ghosh. Sir, you always enriched us with your immense knowledge and innovative thinking. Today, sir, you incredibly enlightened the fact that food is not only any substance that quench our thirst, quench our hunger and thirst, but also it acts like a medicine and can boost our immunity. A healthy lifestyle and healthy food habits can also boost our immunity, even COVID-19 in this pandemic situation. Thank you, sir. Thank you for being part of this webinar. Really, sir, your presence, valuable speech, enhance the essence of this webinar. Thank you, sir. Thank you once again. Now, I would like to thank and express my sincere gratitude to Dr. Sukanta Mondol for his thought-provoking and enlightened speech on the impact of heat stress and nutritional stress on early embryonic survival. Sir, this has really been a very interesting topic and we all enjoy your session immensely. Thank you, sir. Thank you once again. Now, I would like to express my sincere gratitude for our respected principal, sir, Dr. Waterborne Mondol. Waterborne Mondol, thank you, sir. You always encourage and motivate us to innovate, to arrange the different innovative events in our different departments and in our college. Thank you, sir, once again. Thank you for your encouragement and success. Now, I would like to thank our respected department in charge, sir, and convener, sir, Dr. Rajkumar Moiti, for his great endeavor to arrange this webinar in a successful manner. Thank you, sir. Thank you for your guidance and support. I would also like to thank our joint convener, Dr. Prithviraj Karo, for his guidance and support, and to organizing member. And I would also like to thank the organizing member and my dear colleague, Ms. Momita Dotto, Department of Nutrition, for her endless effort to arrange this webinar in a successful manner. I would also like to thank our technical professionals, Mr. Shubhodip Chaudhary and Mr. Tanmoy Park, for their technical support. Last but not least, I would also like to express my cordial thanks all the participants of this webinar who attend this webinar with their great enthusiasm. Thank you all very much again. Stay safe, stay healthy and safe, and have a great day ahead. Thank you.
Thank you.
Today's webinar is end here. I hope you all are enjoying the informative webinar. And we're giving the feedback in also. Thank you all.
Thank you.
Thank you, sir.
Thank you, one and all.
Thank you, one and all.